Understanding and managing your child's asthma. Ari had just started grade 1 and got a cold. Ari also has asthma, so Ari's mother stayed home to keep an eye on Ari. Asthma is a common condition that causes your airways to swell and fill with mucus. This can make it hard to breathe. Asthma can be caused by genetic and environmental factors. Asthma is long-lasting, but symptoms can be managed. There may be times when your child is well and other times when they have more difficulties. Ari was diagnosed with asthma after being sick many times with a cough that wouldn't go away. After a few months, Ari was referred to an asthma specialist by their family doctor. Your child may be diagnosed by your family doctor or a specialist. It may take some time before your child is diagnosed with asthma, even if they have asthma-like symptoms. Many things can affect our breathing, and some diagnostic tests can only be done on older children. Symptoms of asthma can be mild, moderate, or severe, and can vary between children, over time, and across seasons. Common symptoms are coughing, wheezing, and trouble breathing. Wheezing is a high-pitched whistling sound made when breathing. Indrawing is when the skin sucks in around the neck, above the collarbone, or between the ribs. These symptoms are also common in other conditions. It is important to talk to your healthcare provider to understand your child's symptoms. When Ari got a viral infection or a cold, it triggered Ari's asthma symptoms. A trigger is anything that might cause the airway to get thick and swell, leading to an asthma attack. Every child can have different triggers. It's important to know what your child's triggers are and avoid them as much as possible. Common triggers include viral infections, animals, dust mites, molds and pollens, air pollutants, and smoke. Ari's parents were keeping an eye on Ari and giving reliever puffer or inhaler medication, but Ari's breathing wasn't getting better, and soon they saw indrawing. During an asthma attack, airways get thick and swell. In medical terms, this is called inflammation. The muscles around the airway get tight, and the airways make a thick liquid mucus that might block the airways. Seek emergency care if your child's reliever medication lasts less than 3 hours, or if your child is having trouble breathing, is indrawing, or is breathing very fast, or looks blue around the lips, or is very sleepy. Visit your doctor if your child's symptoms do not get better when taking reliever medication every 4 hours, or do not improve after 2 to 3 days, or get worse. Ari did not get better with puffer medication and was indrawing. They went to the emergency department, and Ari was treated with medications to relax the muscles around the airways. Children having an asthma attack often need to stay in the emergency department for 3 to 8 hours. They will be given medication and monitored until their breathing or oxygen levels get back to a normal range. Some children may be prescribed medications to take at home. Some children may be admitted to the hospital if their oxygen levels do not increase or if their breathing is not going back to normal. After a few hours, Ari was able to go home. They were given an oral steroid and were told to continue taking reliever puffer medication as prescribed. All children with asthma are prescribed reliever medicine, such as salbutamol or Ventolin. Relievers work quickly to relax the muscles around the airways and help your child breathe more easily. Your healthcare provider may also prescribe controller medicine, such as a steroid. Controller medicines work slowly over several days and weeks. They help by stopping the airway linings from swelling. Using the controller medicine every day, as prescribed, will help your child have less swelling and mucus. You can help manage your child's asthma by removing your child from triggers, giving reliever and controller medicines as prescribed, and monitoring their breathing. You can also help manage your child's asthma by watching for early warning signs of an asthma attack. Every child will have different warning signs. Some common warning signs are a cough that will not go away, coughing at night, tired soon after playing or exercising, and breathing faster than usual. If your child is old enough to talk, they may also tell you that they are tired, that their chest hurts, or that it's hard or hurts to breathe. Children with asthma need an action plan. Your child's healthcare provider will work with you to make one. Action plans tell you and your child what to do every day to manage the asthma, what medications to take and when, what to do if your child's asthma gets worse, and what to do if your child has an asthma attack. It is very important to share this plan with anyone who spends a lot of time with your child, for example, daycare, school, and family members. This will help them know how to help manage your child's asthma. Regular visits with your healthcare provider can make sure your child's asthma is being well managed and that their treatment is working. Remember, asthma is a long-lasting condition, but with support from your healthcare provider, you can help manage your child's asthma symptoms. And again, always remember these warning signs to help you know when to seek emergency care. Your child's reliever medication lasts less than 3 hours, or if your child is having trouble breathing, is indrawing, or is breathing very fast, or looks blue around the lips, or is very sleepy.